My name is Kathy Lee. I'm a general surgeon by training. Clinically, I still practice, and I got involved with Doctors of BC back then about 10, 15 years ago. It's important right now because in this day and age when everything is tight and we have to figure out how to support physicians who are managing as best as we could with patient care, with the higher cost of living, the higher cost of running an office. How do we support that? And CPHS plays a part in that because it manages things proactively as opposed to retroactively. There's so much patient and there's so much paperwork and so much I need to figure this out. So then CPHS kind of puts it in the forefront, offers it to make it easier for physicians to tackle. It's like, if I can run through these modules, if I can talk to this person, they can help me figure it out. And CPHS has made it easier for us physicians to tackle. I can delegate my trusty office manager. It makes it easier as opposed to sending us like, can you talk to WCB? Can you talk to the college? Can you talk to all these different entities? So then CPHS gives us like a one source of truth that they can go to. If you have questions, then there's office supporting staff that can help us. There is a resource that is available to us that's easy to access and has the overall mandate of like overall patient care still, but then it considers it sympathizes with us physicians that we have to not just provide clinical care, but there's other things that we have, the operation side of it, that patients aren't aware of. I guess they don't realize that we have the office staff that's helping them, that's calling them, that's their point of contact, is actually my staff, that I'm responsible for them. So they don't recognize that. And then what's improved is that there is that one source of truth where they have one entity that is a recognizable name that they can head towards. So then this de-escalation tool is helpful for me to offer to my staff. Like, you want to try this? I hear through the door that patients are complaining to you that I'm late, but it's my fault that I'm late. But thank you for taking those complaints. But maybe perhaps how you can de-escalate. This is a tool that might be helpful. And keep in mind that I'm a physician. I'm not trained to be HR, but in the office, I am forced to be HR. I'm forced to be my own security guard, and I'm forced to train, hence my MOAs, and I want to retain her. So in the end, this de-escalation tool is a resource that I can offer my staff to show, A, that I hear, I have resources that I have borrowed quite conveniently, and see if we can benefit. Explore, have a look at us before you hear from the college, before you hear from WCB, and we all hear horror stories of how things can go wrong, and when they go wrong, they can go wrong a lot, and they take a lot of time.